Hi guys, today's topic is hypothyroidism, a very common disease about which everybody wants to know. So let's start. Hypothyroidism. It is a deficiency of thyroid hormone which may be subclinical or clinical. Common causes. It can be congenital, that is since birth, which may be due to gland dysgenesis, which accounts 85%, plus defect of thyroid hormone synthesis 10%. Means it can be both or any one reason. Number 2, acquired causes, which includes iodine deficiency. Number 2, autoimmune thyroiditis, which is actually most common cause, also called Hashimoto's disease. Third, postpartum hypothyroidism. Number 4, iatrogenic, that is may be due to radioactive iodine treatment. Actually, it is used to treat thyroid cancer, subtotal thyroidectomy, clinical treatment done in case of Graves' hyperthyroidism. Number 5, drugs like lithium, antithyroid drugs, etc. Number 6, secondary to pituitary disease, means hypothyroidism occurring due to some pituitary disease. Congenital hypothyroidism. In congenital hypothyroidism, patients mostly appear normal at birth. Approximately 10% children are diagnosed clinically because of prolonged jaundice, feeding difficulty, delayed growth, delayed milestones. Its diagnosis is made by decreased T4 and increased TSH. Treatment. It can be treated by T4 in dose of 10 to 15 microgram per kg per day. Now, Hashimoto's disease. It is defined as autoimmunity against thyroid follicular cells. Causes thyroiditis, which leads to number 1, hyperfunction of the gland. Number 2, T3 and T4 are decreased. This causes increased TSH, leads to thyroid hyperplasia, means thyroid enlargement, or we can say goitrous thyroid. So, because of thyroid hyperplasia, T3 and T4 becomes normal, but TSH is increased. In this situation, patient may have only minor symptoms. So, this stage is called subclinical hypothyroidism. Incidences of hypothyroidism. Number 1, most common in female. That is about 20 times. Incidences of hypothyroidism increases with age, and mean age of diagnosis is 50 or 60 years. Clinical features of hypothyroidism. In initial stage, it presents with goiter. Here, goiter is not large but irregular and firm. In later stage, develops atrophic thyroiditis and features of hypothyroidism. Other clinical features. As we can see in the picture, it includes intolerance to cold, shown with sweater and gloves, receding hairline, facial and eyelid edema, full blank expression, extreme fatigue, thick tongue, which leads to slow speech, anorexia, brittle hair and nail, menstrual disturbances, constipation, dry skin. Notice guys, the person is carrying body lotion, etc. And some late clinical features like subnormal temperature, bradycardia, weight gain, locally thickened skin, cardiac complications, etc. Lab diagnosis. Most importantly, TSH, T3 and T4. It can present with two conditions. Number 1, TSH increased, T3 and T4 decreased. It confirms the diagnosis. But second condition, where TSH is increased but T4 is normal, indicating subclinical hypothyroidism. Number 2, hemoglobin found decreased, lipid profile, cholesterol and triglyceride both increased, ECG, that is electrocardiography, indicating bradycardia, X-ray, which may shows cardiomegaly. Let's see treatment now. Number 1, daily replacement dose of levothyroxine in dose of 100 to 150 micrograms. In patients with subclinical hypothyroidism, lower doses are used. Ideally, TSH response should be judged after 2 months. Once after full replacement and TSH level is stable, follow-up measurement of TSH are recommended yearly. Now, here is a star point for you. If patient is taking more than 150 microgram per day of levothyroxine and TSH level is still elevated, then it is mostly due to poor compliance, means patient is not taking the medication properly.
धन्यवाद। अगर आपको वीडियो अच्छा लगा तो लाइक और कमेंट कर हमें भी बताएं। अगर आपको लगता है मेरे वीडियोस आपके काम आ सकते हैं तो चैनल सब्सक्राइब कर बेल का बटन अवश्य दबा दें सो दैट यू वोंट मिस एनी फ्यूचर नोटिफिकेशन। इफ़ यू थिंक मेरी वीडियो किसी के काम आ सकती है तो यू कैन शेयर इट टू।